I'm super jazzed to be here today with Jenny Call, who is the owner and CEO of
Santa Cruz Myofascial Release and Integrated Therapies.
I'm going to say it.
It's kind of a mouthful.
Santa Cruz Myofascial Release and Integrated Therapies.
Yes.
Nailed it.
Yay!
Woo! So Jenny, what exactly is myofascial release and integrated therapies? What do you do on a daily basis with do you call them patients?
I call them clients.
Clients.
I'm not a doctor. I'm not a physical therapist. I am a certified massage therapist who specializes in myofascial release. So I just say I'm a myofascial release therapist.
Okay. What is that?
That's a great question. So myo, I guess technically means muscle, and fascia is the connective tissue that essentially holds our body together. So I'm the therapist that works within the connective tissue to help bring our bodies back into balance and out of pain and improving overall health and mobility.
How did you get into this specialty?
Oh, yeah. So that's a good story. 20-something years ago, I discovered myofascial release, and actually I had horses at the time, and so I discovered myofascial release after my horse first got treated, before I did. But I had a couple of pretty decent accidents. I was thrown off a horse in the middle of an intersection, and then the following year I was in a pedestrian accident, and I was hit by a car crossing the street, and I had minor injuries, fortunately. I had a herniated disc in my L4, L5, and then I had 3 bulging discs in my neck. So I was working in research at the time. I was working for a pharmaceutical company, and I was severely limited as to what I could do. So I was put on medical leave after about 6 months of being on severe work restrictions, and I ended up moving down to Santa Cruz, and I bought my first horse, and he was definitely not like... He was this cute, spunky little chestnut, but he had this really deep sway back. And I ended up, after I purchased him, I moved him to a boarding facility in Watsonville. And I had someone come up to me and ask me if she could do body work on my horse. And I had never had a massage. I had never had any acupuncture. I had chiropractic, me personally.
But what about for your horse?
He got it first.
That seems unfair.
My critters come first. What
okay.
can I say?
Okay.
But so she had started to treat him, and she had done about 4 treatments on him, and his back filled in and his head and neck dropped down. Like, he was just this completely different horse, and he was moving differently, and he was always really spicy, but you could tell like he wasn't in pain.
Wow.
And I looked at her and I'm like, so what you did for him, can you do for me? And that was my first experience. That was my first myofascial therapist.
Did she say she could do both? She does horses and humans?
So she was starting to work on horses, and she had a really long established practice of working with people. So I started working with her. I was with her for a couple of years, but I was working with her on this particular issue for about 6 to 8 weeks. Okay. And I would go in like twice a week. Okay. And the work that she did completely resolved me of any pain and discomfort.
That's insane.
And 20-something years later, I have no sciatic pain. I have no back issues. Wow. So that was my first experience with myofascial release. And then fast forward a couple of years through marriage, kids, divorce, I needed to figure out something that I could do on my own schedule to accommodate the times that I have my kids, but then also create a business that would help to sustain us. And I wanted to be a birth and postpartum doula, but as most of us know, babies don't come on the schedule at all.
Ever. Nope.
So,
first lesson in parenthood.
Yeah. I have both of my kids at night, so having a 2-year-old and a 4-year-old was not going to work in pursuing that kind of.
Them.
No. So then I was thinking, well, what could I do to? What are other doulas and other birth workers doing to supplement their work? And I saw that a lot of them were teaching yoga, acupuncture, massage. And I thought, well, I could do something like that, but I don't want to do regular massage. And then I thought about, well, what if I did myofascial release?
Because it changed your life and your horse's life, so it seemed like the right path to take.
Yeah. And here we are, 12 years later.
Wow. So what do you think is the most rewarding part of your job?
So I think the most rewarding thing for me was having the support to be able to build this business. But then for my clients, it's being able to provide them with the service that actually gives them the results that they want and need.
That's really cool. And what do you think is the most challenging part of your business?
Being a business owner.
Oh, yeah.
And doing all the things like not decorating.
Right.
That I need to do to just get through the day-to-day stuff.
Yeah. It's interesting because businesses are usually comprised of actually artists or artistry.
Mm-hmm.
Somebody who specializes in a specific unique talent, but then the component of actually facilitating a functional business is a totally different set of tools, skills, mindset, abilities, and to integrate both is a challenge I've noticed, and seems to be across the board. You either have one skill set or the other, and then to blend them is really challenging, which is why a lot of artists have business partners.
I was not prepared for all the business stuff.
I don't think anybody is.
At all.
What about the paperwork? Isn't that fun?
Oh, yeah. Fortunately, with my practice, I actually don't do any intake forms.
Oh, that's good.
So I keep it to a minimum. But it's. I am very grateful that I have other therapists and other tenants here in the building that do help with a lot of the things that I fall short on.
Yeah.
Case in point, you'll see that some of the doors have name tags on them. They did that.
We could get you one.
I could do that.
Yeah.
I could actually do that.
That would be like a pretty simple little
Yeah.
I think they even have them on the internet.
Oh, the interwebs.
Yeah.
Wow.
Have you ever had a case where a client comes in and you thought, oh geez, I'm not going to be able to help them the way that I want to, and then the outcome was more favorable than you expected?
Yeah. One client in particular who probably came to see me and worked with me for the better part of 5 years. He was a retired pipe fitter. And so he had been in the industry for over, 30 something years. And he had a lot of chronic issues. And I honestly thought, I don't think I can help this guy. But he was insistent that the work that we were doing was helping. And he came in, started out at 3 times a week for probably the first 2 years. Went down to twice a week. And then scaled back to once a week. And that's probably more of an extreme case.
Mm-hmm.
I don't see a lot of those clients in my practice right now. But it took so long because everything in his body was just so tight. It just took so long to see any progress.
Mm-hmm.
He was feeling the progress.
Mm-hmm.
I wasn't feeling it as much as he was. But then we'd have those moments where something would shift and move, and it's like, you weren't able to do that a month ago.
Wow.
Yeah, it does happen. And fortunately, most of the clients that come in to see me don't necessarily have that level of dysfunction.
Yeah, that seems like an extreme case.
Yeah, that's an extreme case.
Is the objective for them to stop seeing you at
Yes.
some point? So it's not like a casual massage where it just feels good and
No.
your muscles are sore. Like the objective is to actually get you to the
Yes.
outpatient point.
Yeah. In fact, I tell a lot of people this is the worst business model ever because I really want to work myself out of seeing clients, but they just keep coming back in. So my goal with my work is to do as much work as we can in the beginning so that it gets them off the table and out and not feeling like they need to come back unless it's like a maintenance type of thing
Mm-hmm.
where we can have them come in once every 2 to 3 months.
Mm-hmm. You're like, come in, I'll heal you, and you won't need to learn anything.
I like to do the hands-on stuff.
Yeah.
I am not an academic person. So there are a number of therapists who can rattle off like what muscle group they're working on and where the insertion and the attachment points are. If that's who you want, I have people to refer you to. That is not my specialty.
Okay, fair enough.
I work more intuitively.
Yeah.
So I just communicate with the body a little bit differently. With a new patient or new client, I do a 15-minute visual and verbal intake. So we talk about what's going on, what's bringing them in. I have them take their shoes off so I can look at their body and see how their body is balanced in space. That gives me an idea of where how to get them positioned on the table. I always start where they're feeling the most pain or discomfort. But the key is that where you're feeling the pain or discomfort may not be where that is originating. So I study under John Barnes, and John always says, start where they're feeling the pain or discomfort, look elsewhere for the cause. So because our body is this insane interconnected web of connective tissue, everything in our body is connected. So like you were talking about, I think it's your upper traps or something that's bothering you. That's where I would start with the work. And then I would also probably want to see what's going on in your pelvis and, you know, maybe other areas, because there's no one way to go about treating someone. It's trying to figure out what the right combination is, and, you know, different positions, and do I need to do more tractioning or like more focus point work? So it's not there's no structure to the treatment. It's and what I ask clients that are coming back in, okay, how's your body feeling today? And then they'll tell me, well, something else is going on, so this is where we're going to start today. I really like working on newborns and infants before they start to move, and then
how does that treatment work?
Oh,
how does that look? Like, I can't communicate with you yet, clearly.
They can, though.
They can?
They can, yeah. So when there's a restriction going on in the body, there's a couple of things that happen. Usually there's a temperature increase or decrease, so temperature change. The capillaries will often burst, so it's called vasomotor dilation, so it looks like redness.
Yeah.
So the indication of difference of heat, redness. Oftentimes, like if you get little muscle twitches or, you know, things like that are happening, it's kind of an indication that something's just not functioning properly.
Yeah.
So if you tune into what's going on in the body, even though some people can't verbalize it, we still know where to start. So yeah, I love working on babies. Like, do it when they're young.
Wow.
So that they don't have time to accumulate.
Have you seen, like, okay, you meet a baby, you work on a baby, have you seen the progress over the course of their life, or like later, like as a teenager, you re-meet them, or you've been in it for 12 years?
Yeah.
Okay.
Well, both of my daughters were treated after they were born.
Okay.
And I do treat them sometimes when they let me, or when they ask me, but it's usually like at 9 o'clock at night.
You're like, I'm exhausted.
I'm done.
Yeah.
By that time. So.
Make an appointment.
Yeah.
My office hours are 9 to 3. Even having been adjusted or what do you call, worked on as a baby, you're gonna still re-injure.
Yeah, so it won't cure you for all of the injuries that you're gonna have throughout the course of your life.
That's too bad. That would be the worst business model.
Oh, but just, yeah.
Like, work on a baby and they're set for life.
Treat something when it happens and don't leave it. Just don't ignore it. When you're in pain, deal with it.
Yeah.
So, yeah, I think that's the biggest lesson. I always recommend, if people are to get checked out by your primary care doctor. Oftentimes they will tell you it looks like it's a soft tissue injury, and there are many different courses of therapy that you can pursue. this is one of them. I don't take insurance, so that's probably something that other people need to know. But so all of this is done out of pocket. I do take some HSA and FSA cards for payments, so that's an option. It is kind of a trip when people tell me that their doctor recommended that they get myofascial work, and then they go online and they Google myofascial release Santa Cruz, and I'm usually the first one that pops up.
Good name,
so
that.
yeah, yeah. So that's generally internet search, I guess, is how most people find me, and then I do have my hands in a couple of different networking groups. And I did have a suggestion.
Okay.
If you have a minute and are willing to lay on the table.
I was hoping you would offer me a massage.
All right, and I always ask for consent before I touch anybody, so I apologize. May I touch you?
Yes.
Thank you.
Please do.
Okay. So, and if anything we're doing is beyond your level of therapeutic discomfort, please tell me to back off or stop. That's the other thing. I have had so many people come in and tell me that they have either been re-injured or by body work, or have had body work that's just been too deep. And it blows me away that people didn't know they could tell their therapist to lighten up, or
Wow.
or lighten their touch, or change positions.
Right.
Communicate. They didn't know they could communicate with their therapist.
They have to be their own advocate.
They do. And I can feel what I feel, but if they're feeling something different, then I need to know that. So please communicate with me.
That feels good.
Good. Is it this spot right
Yeah.
in here?
Yeah, you found it already.
That's a good one.
And it goes all the way to the left side of my neck. Wow.
Okay.
You found it just like that's the spot. Jenny, you are a magician.
With this work, I normally work with skin on skin with no creams or oils. I don't want to use oils because I need to be able to feel where the restrictions are. I also need to be able to get a good grip sometimes. So if I'm all lubed up, that ain't gonna work very good.
Yep.
You will find, like, I stay in certain positions for an extended amount of time because it takes at least 90 seconds to 2 minutes for your connective tissue to start to soften, and then beyond that, it's additional time for it to move and to start to unwind itself from the position that it's got itself locked up in. So all of my treatments are 90 minutes, and then the first one is an hour and 45 minutes because we do the 15-minute intake prior to. But they're longer treatments, and that's why, is because I just need more time. Movement is also something that's really encouraged in this treatment. So if you feel like you need to move, just move. I'll go with you. I promise I won't let you fall off. I don't know if you can feel that movement. That movement is not generated by me, by the way.
I can't feel it.
What's it, Jen? Is me? I'm doing it?
Yeah,
My body's doing it?
your body's doing it.
Is it healing itself?
It's unwinding itself. And unwinding is good. We want that.
I do feel it. It's like a little pulsing.
Yeah. That's you. That's not me.
You're not moving your finger like that? Wow, that's weird.
Yeah. I'm just going with it.
My body is just weird.
Your body's amazing. Our bodies know how to heal themselves when we get out of our own way and allow that to happen. So when people leave the treatments, there's two things that I always recommend. That they're feeling pain and discomfort in specific areas, I always recommend heat and hydration. Heat keeps your body softening and opening and encourages movement. And then hydration, when your connective tissue is in a frozen, locked up state, it's very dehydrated, and it's not able to really take in and absorb any nutrients. And so as we start to work on those areas that are dehydrated and frozen, we start to get them warmed up and moving, you're going to want to re-nourish them. So sticking with clear fluids like water, herbal tea, bone broth, not vodka. Somebody asked me that. Give yourself at least 24 hours. That'll loosen you up. Exactly.
Tequila?
Non-alcoholic
Got it.
beverages.
Got it.
And then heat, of course, like a hot tub. Oh, what I wouldn't do to have a hot tub. You know, bath. Yeah. Even just, you know, using a heating pad, because that'll keep your connective tissue softening and moving, and that's really what you want. I tell people the treatment really begins once you get off the table and your body has to figure out how to integrate into a three-dimensional space again.
Well, then I don't want it to begin.
Yeah, so just see how it feels over the next couple of hours and see, you know, what comes up. And there's also, not for everyone, but some people do have an emotional connection to physical pain. So there can also be big emotions that come up, not always, but just, you know, I kind of give people a forewarning. I'm not equipped to handle that, but I can refer to other people who are. But if there are emotional things that come up, do whatever you need to do to move through it, and address it. And don't drink the vodka. Don't keep stifling it, because that which you resist persists.
Yes.
Right?
Yeah.
And then you can feel amazing. You could feel like you can go run a marathon, or you can feel like you just got hit by a train. Anything and everything in between is totally normal.
I feel really loose right now.
Yeah.
And I'm like a little bit lightheaded too.
Yeah, that's normal.
Loose and lightheaded.
Yeah.
So there you have it. Jenny calls beautiful practice of myofascial release and integrated therapies.
Perfect.
In Santa Cruz.
Yeah.
Santa Cruz. Next time.
Thank you.
Check her out.